Welcome to today's lecture on the fascinating field of medical nanotechnology. In this lecture, we will explore the various applications of nanotechnology in hearing restoration. Nanotechnology offers the potential to revolutionize the way we diagnose, treat, and prevent hearing loss. By manipulating and engineering materials at the nanoscale level, we can target specific cells and structures in the inner ear, leading to improved outcomes and enhanced quality of life for patients suffering from hearing impairment. Nanotechnology involves the manipulation and control of materials at the nanoscale, typically ranging from 1 to 100 nanometers. This field encompasses various disciplines such as physics, chemistry, materials science, and biology, and it has shown immense potential for biomedical applications. In the context of hearing restoration, nanotechnology offers unique opportunities to address the challenges associated with inner ear disorders. By developing innovative approaches, researchers aim to restore hearing by targeting specific cells, delivering drugs more efficiently, regenerating damaged hair cells, and protecting the auditory system from further damage. Nanomaterials play a crucial role in the advancement of hearing restoration techniques. These materials possess unique properties at the nanoscale, such as high surface area to volume ratios and improved biocompatibility. Researchers have focused on developing nanoscale drug delivery systems that can efficiently transport therapeutic molecules to the desired location within the inner ear. Nanoparticles, nanofibers, and nanocomposites have been explored as potential carriers for drugs, growth factors, and genetic material, offering controlled release and targeted delivery. Effective drug delivery to the inner ear remains a challenge due to the blood labyrinth barrier. Nanomedicine approaches, such as nanoemulsions, liposomes, and polymeric nanoparticles, have emerged as promising solutions to overcome this barrier. These nanocarriers can encapsulate drugs and protect them from degradation, enabling sustained release and enhanced bioavailability. Furthermore, surface modification of nanoparticles allows for active targeting of specific cells within the inner ear, improving drug delivery efficiency. Cochlear implants have transformed the lives of individuals with severe hearing loss. However, their performance is limited by the interface between the implant and the surrounding tissues. Nanostructured scaffolds offer a solution to improve the integration of cochlear implants with the surrounding tissue. These scaffolds, fabricated using nanofabrication techniques, can mimic the extracellular matrix and promote cell adhesion, proliferation, and differentiation. Additionally, nanoscale topographical cues on the scaffold surface can enhance the guidance of neurite outgrowth, improving the connection between the implant and the auditory nerve. Accurate assessment of hearing function is crucial for effective diagnosis and treatment. Nanosensors and nanodevices have shown great potential for precise and non-invasive hearing assessment. These devices can detect and measure auditory signals at the nanoscale, providing valuable information about cochlear function and auditory processing. Nanosensors can be integrated into hearing aids or implantable devices to monitor and optimize sound amplification settings, leading to personalized and improved hearing outcomes. Hair cell loss is a major cause of hearing loss and currently lacks effective treatment options. Nanotechnology offers promising strategies for hair cell regeneration. Nanomaterials, such as nanofibers and nanoparticles, can be used to deliver growth factors, gene therapies, or stem cells to stimulate hair cell regeneration. Additionally, nanotechnology-based approaches can provide mechanical support and enhance the survival and functionality of newly regenerated hair cells. Tinnitus, a phantom perception of sound, affects millions of people worldwide. Nanoparticle-based therapeutics have emerged as a potential treatment option for tinnitus. By encapsulating drugs within nanoparticles, controlled release and targeted delivery can be achieved, leading to reduced symptoms and improved quality of life for tinnitus patients. Furthermore, nanotechnology-based approaches can modulate neural activity and restore the balance between excitatory and inhibitory signaling pathways, potentially alleviating tinnitus symptoms. Outer ear defects resulting from congenital malformations, trauma, or cancer resection pose significant challenges for reconstructive surgery. Nanotechnology-based approaches offer solutions for the development of functional and cosmetically appealing outer ear prostheses. By leveraging nanomaterials, such as biocompatible polymers and nanocomposites, prosthetic ears can be fabricated with improved mechanical strength, biocompatibility, and aesthetics. Moreover, nanoscale surface modification can facilitate cellular attachment, promoting tissue integration and reducing the risk of implant rejection. Understanding the intricate structure and function of the inner ear is essential for the development of targeted therapies. Nanoimaging techniques, such as scanning electron microscopy and atomic force microscopy, provide high-resolution imaging capabilities to visualize the nanoscale features of the inner ear. By gaining insights into the cellular and molecular architecture, researchers can identify novel therapeutic targets and improve the design and efficacy of nanotechnology-based interventions. Prolonged exposure to excessive noise can lead to irreversible hearing damage. Nanotechnology offers innovative solutions for noise protection, with the development of advanced nanomaterials for sound absorption. Nanocomposite materials, incorporating nanoparticles with specific acoustic properties, can effectively reduce noise levels by absorbing and dissipating sound energy. These materials can be integrated into protective earmuffs, earplugs, or even clothing, providing enhanced noise reduction for individuals working in high-noise environments. Nanorobots hold immense potential for precise and targeted therapy in the inner ear. These miniature robotic devices, typically constructed from biocompatible materials, can navigate through the complex and delicate structures of the inner ear, delivering therapeutic agents to specific cells or regions of interest. By incorporating sensors and actuators at the nanoscale, nanorobots can autonomously detect and respond to pathological conditions, enabling personalized therapy and minimizing off-target effects. Gene therapy has emerged as a promising strategy for treating hereditary hearing loss. Nanotechnology plays a critical role in gene delivery by protecting and efficiently delivering therapeutic genes to target cells. Various nanocarrier systems, such as viral vectors, lipid nanoparticles, and polymeric nanoparticles, have been investigated for gene therapy in the inner ear. Nanotechnology enables precise control over gene expression, offering the potential for restoring or enhancing auditory function in patients with genetic hearing disorders. In conclusion, the integration of nanotechnology into hearing restoration holds great promise for improving diagnosis, treatment, and prevention of hearing loss. Nanomaterials, nanomedicine approaches, nanosensors, nanostructures, and nanorobots offer innovative solutions to overcome the limitations of current therapeutic strategies. By harnessing the unique properties of nanoscale materials and devices, we can pave the way for personalized and more effective interventions in the field of audiology. As further advancements are made, the application of nanotechnology in hearing restoration will continue to evolve, ultimately benefiting millions of individuals worldwide.